Dr. Praveen Raj sir to be with me, and I'm privileged that sir is there and sir will listen to my talk. Thank you, sir. I bring greetings from Kanpur, Uttar Pradesh. I will just ask, I have been given 8 plus 2 minutes for this. I will ask 1 more minute addition for this. I have prepared this presentation. So these are my disclosures. And I have prepared this presentation through my own personal experience and through my journey through bariatric surgery at GEM Hospital, Coimbatore. I was among the first fellows from the FMBS academic year. This is the third and fourth year that we have been there, and I also started to gain few information from other centers, higher centers, and also the 2-tier centers with seniors whom I've asked. I might be sometime wrong, but we can talk about that.
Shivansh, you can just move behind because it's booming. They don't have the filters.
Okay, sir. Right. So I might be wrong, so we can have some discussion later on. So when we are setting up a bariatric program, there are so many things that come into mind. What are in a 2-tier city? I'm talking about not the corporate, the big metros. I'm talking about 2-tier. What are the patient's expectations? What are the budget values? What are the hospital requirements? And other small things that come into mind when we are setting up in a smaller city. So if we think from what a patient wants, it's he wants to come in a very comfortable zone. He wants to meet his doctor in the local linguistic language, and the doctor should be approachable. The amount, the finance is very, very important in a 2-tier city, and of course the follow-up, everything is so important. Surgeon, of course, as a bariatric surgeon, if you are trained, he wants a good OT, good endoscopic suite, good assistants to be with him, and then a multidisciplinary team, as we all know in a bariatric surgery. What do the hospital want? Well, that we can talk about that later. But again, if we conglomerate that, it's basically a multidisciplinary team service with facility resources and recruiting the right facility and faculty at the right moment and being perseverant. As Praveen sir told in the last OSCE, I remember the game of numbers. So that the numbers, it is important that we should not be carried away. Okay, he does that way, he does so many numbers. If I am at my city at Kanpur, if I am doing 1 case a month, I am very happy. I am happy because the footfall has increased. I am happy because of that. So you should be perseverant, and you should be with the proper skills of marketing and proper education, we can move forward. We have to hone the bariatric skills by doing observership programs. We are lucky that OSCE has started with the FMBS, and I'm again very lucky to be the first batch of the FMBS and doing the fellowship of FMBS under Praveen sir. And we have a lot of center of excellences throughout India, which can cater and how people like us and surgeons can develop the skills of bariatric surgery. We have to choose the correct mentor. That's very, very important. We have to learn, apart from the surgeries, is how to deal with the patients. When I was there as a consultant, as a SR registrar, I used to see the patients. I used to write the notes. I used to see what the patients know. Initially, I used to sit with my boss, and I used to see how he communicates with the patients. So all these things, the emotional balance, all these things, we have to learn how to deal with the patients and empathy and all these things. Then, of course, the outpatient and inpatient services. We have to definitely know how to do an ideal bariatric procedure. No bariatric procedure is suitable for one. We have to tailor make it as per the patient, as per the patient's profile. So when we come to the hospital infrastructure, right from the OPD, when the patient walks in, patient should feel comfortable. Most of the time in 2-tier cities, we do not have ample of spaces. So we should try that we create a small space which is little bit secluded from other people. Patient should have a bigger BP cuff. The commode should be in the wider, and he should have some supports. The patient should be comfortable, at ease to be with you. Then, when it comes to the indoor, then there are dedicated wards with specialized trained people that should be there with the anti-skid mechanisms, and then trapeze should be there. The wheelchair, the chairs should be broad. Then the commode, everything should be having support just to facilitate the ease for the patient. Then coming to the OR, we should definitely strive for having 2 monitors. There should be endoscopic suite so that we can perform on-table endoscopy. We should be having good energy sources, good camera system. Then of course the prosthesis and the staplers. Bariatric patients are prone to develop this thing pressures points this thing, and they should be properly strapped and should be properly cushioned so that they do not have sustain any nerve injuries. Apart from the long instruments and the DVT pumps and the body composition, there are so many things that we have to take care. Then once you do the first surgery, it's always a bliss. I remember the first surgery when my boss Praveen sir gave it to me, and it was like the best moment of my life. And this is the picture that I from GEM Hospital, and we have to that's a moment that we cherish. We have to develop a bariatric team. I was very fortunate that we had a wonderful team there at GEM Hospital, and then with proper anesthetist, coordinator, physician. We have Prabhakaran sir also here. He was so competent. We used to proper rampage. We used to learn so many things from our anesthetist and also the multi-specialty physicians and endocrinologists as well. Then educating the hospital staff. We should be having proper empathy for them. Then that's very, very important. We should not treat them as just like any other patient. But again, whatever I'm telling you is all expectations. Okay? Now when we come to the like 2-tier city, when I'm in Kanpur, I'm practicing, it's the reality which I want to talk and how I'm trying to bridge that gap. So this couple of 3 to 4 minutes I'll be taking, it's about the sensitivity. About most of the people think, bariatric surgery, because they're not used to seeing the bariatric surgery patients every day. So they're saying, okay, so we have to tell them, they have to sensitize these patients, my coordinators, how to deal with these patients. And after training them, we have to retain them. Because in places, they just run away. They try to move to some other centers. Again, retention is very, very important. Then people think bariatric surgery is a very rich sort of, we have to go to some bigger hospitals and all. We have to break that jinx, and we said no, it can be performed very safely in a 2-tier city, and it should not be a status symbol. It can be very, if you are well trained, we have to educate, and that's your art of communication. Then now the insurance is have come into point, and again I would say congratulate the Aussie who has been doing wonderfully for the insurance people, and since October 2020 IRDA has very much said that bariatric surgery can be put in the insurance. We cannot survive only on bariatrics. We have to combine the pharmacotherapy and other procedures. And basically in a 2-tier city, it's of course a passion practice. If I'm doing one surgery a month, it's about my passion. I am known as a bariatric surgeon in Kanpur, and I'm proud to say that. People are getting to know me and they come to me to get advice. Even the footfall has come up. Then ultimately the solutions are, we have to maintain the adequate expertise, the infrastructure, the manpower resources. We have to be available 24/7. The follow-up is very important. It's because not only the patients we follow up, the patient can tell to their relatives or their mohalla walas or their local fellows, what about these bariatric surgery? And so you have to keep on ringing them and calling them back. Marketing is a very, very important thing. And now every person in the world is now techno-savvy and is now updated in these smartphones. So it's about how well we do the marketing. Very, very important. Then always never fall into price tag that I do it for 1 lakh, I do it for 1.5 lakhs. Because one patient goes wrong, your bariatric practice will go down from 3 to 4 years back. So always maintain an average rate and never fall for the price tags. And then avoid the initial mishaps at all costs. I'll take 1 more minute, sir. Then, and get yourself trained at good centers, and if possible, get yourself the COA accreditation, which is possible. I have been trained with the best. My boss, Dr. Pallivellu sir, I always, whenever I look into and do some difficult case, I just close my eyes and remember him, Praveen Raj sir, Mahendra Arya sir, everybody, my father also. Even I've seen how he has the art of laparoscopic and the patient communication. I've learned so many things from him. Then we have to go and do the support group meetings, strive for the industry support like the Rotary Club, Lions Club, so that you can get some support from these people. And ultimately do the best for your patient, because one satisfied patient will bring 10 more patients to you. Then, of course, maintain the data, and important thing is that publish, because if you don't publish what you have done, you definitely you don't come into the thing. And again, I am very fortunate. Again, I would like to thank my boss, my mentor, Praveen Raj sir and Saravana Kumar sir. I was nothing. I am telling you, I was nothing. I never knew the word, but he told me, if you don't do publication, you will not do any cases. So it was his endeavor. He pushed me to publish, and I am fortunate to publish so many papers during the tenure. And I always, whenever I meet Praveen Bhatia sir, I meet seniors, I ask them, sir, can I get some papers of this thing, anything which I can do, contribute from my side. So these are so many things that like that matters actually when you are in the private practice and you want to set up a bariatric program in your 2-tier city. Because, and this is how I got the Best Researcher Award of India by JMAS Award in IAGS, and the Young Aussie Award also I got in Bangalore. So these things are there, and conducting surgical workshops, and now the insurance and CGHS works are also now bariatric. They are this thing now they are supporting. So we have to catch hold of the insurance guys and CGHS. I myself have done 3 patients who are from CGHS. Even though I have not got the adequate amount, but I am happy that I am able to cater those people. So ultimately, this is very important, and that the end of the slide is work as a team, and we have to find the perfect balance. And just keep on working, just don't be disheartened. Even if I don't get a case a month, I'm not disheartened. I try to do something else. I try to do academics, I try to do some research work. I try to speak to my seniors, sir, what to do, what not to do. Then life should move on. And that's how I have set up my bariatric program. Thank you so much.
I think whether you in tier 1, tier 2, tier 3, whatever, now that you're talking about tier 2, let's stick to tier 2, but don't you often find more, it's more the rule than the exception, that when a patient comes to you, patient is expecting you to be the surgeon, the physician, the dietitian, the counselor, everything.
Yes, I am everything, sir.
No, you have marketed yourself very well, it's very good, but you must also know your limitation.
Yes.
Yeah? So whenever what happens is they feel surgeon ke paas gaya is one and all. It's like, you know, Lord Shiva or something sitting there that you know everything. So this is something that you will have to educate people that there are certain things that you may have to refer to other people.
Oh yes, I have. We developed that program, sir, and
yeah, you may have a multidisciplinary team, but to send patient to especially to a counselor, very difficult. Next is the nutritionist or the dietitian. They don't want to go, or even if they go, even if you give them the number, they will not call up.
No, we have a nutritionist, sir. With due respect, all these things are there. But in case you have to take a lead and you have to take everything, sir. I remember him, Praveen sir, also talking about everything, like even the dietitian, the sleep therapy, the emotional thing. I've seen him. So that's what. You have everybody in the department, but you have to take the
But you
ones.
still have to be the jack of all trades at least,
Yes.
even if you can't be the king of it.
Yes, sir. Thank you, sir.
Sure, that was a beautiful presentation. I don't have any question, but I think you've really concised it extremely well.
Thank you, sir.
I think for the information to the audience, so this is actually a Young Aussie session that we've been doing it year on year. The program is planned and run by the Young Vertical of Aussie. And we have this program along with integrated health primarily because we want the integrated health members also to know what is happening with budding surgeons. What is the difficulties? Because you might be working in centers where it is already established, you would just go and take it on. Then you might need to know from the basics. So this will be a good opportunity for interlearning from the young surgeons and the young surgeons from you that we have planned it. And we have a very dynamic Young Aussie group, I think led by Vinay and Pallavi used to have Pallavi hasn't come, Namita is here, Shivanshu. I think a beautiful young team, they've been running it. So I think this is probably the session that all of us need to look for. Probably if we can get more people come from there, perhaps to all of you. But then a beautiful presentation.
Thank you so much, sir.
All the best to all of the youngsters coming in.